all our media friends all over the country, and welcome to the campaign launch of Dahil Mahal ko kayo, Magpapabakuna ako. I am Maria Angelica Di Abad, Assistant Vice President for Public Affairs and the Director for the Office of Alumni Relations at the University of the Philippines System, as well as a proud faculty member of the UP Diliman Extension Program in Pampanga. It is an honor for me to share the hosting duties this morning with a respected communication researcher and a professor at the UP College of Mass Communication. He is also the Special Assistant Vice President for Public Affairs, Dr. Jonalu S. Labor. Hi, Janelle. How are you this morning?
Hi, Rika. It's an exciting day, and I am looking forward to sharing the media collaterals resulting from months of tedious research from the UP research team on communicating COVID-19 in post-quarantine Philippines, headed by UP System Vice President for Public Affairs, Dr. Elena E. Pernia, and funded by the DOST, PCHRD, and DOH Project Ahead. Our media friends really have a large role here in disseminating correct information in order to win this battle against infodemic surrounding vaccines and vaccination, which causes vaccine hesitancy among our vulnerable populations.
Yes, Janelle, one of the first things we always tell everyone is to always verify your sources. So let us now introduce our interdisciplinary research team, composed of experts from different fields, including communication research, journalism, film, advertising, psychology, statistics, and the social sciences for their invaluable contributions. It was really a challenge to undertake research during the different levels of quarantine during this pandemic.
Yes, it really takes a village to undertake a research at this huge scale. So we employed a mixed paradigm research design using both quantitative and qualitative methods like surveys, key informant interviews, and focus group discussions, as well as content and sentiment analysis, and then harnessing all the information to produce appropriate media collaterals to encourage COVID-19 vaccination among the most vulnerable sectors of our society. We also would like to acknowledge the following institutional partners for their unwavering support, without whom this campaign would not have been possible.
Yes, thank you to everyone for making this time from your very hectic schedules. Your presence here this morning affirms the importance of this vaccination drive to protect ourselves and our loved ones against COVID-19 and its variants. As Janelle mentioned earlier, it takes a village to mount this research, but it will take the whole nation to surmount this COVID-19 pandemic. Each one of us has a role to play, and your participation in this campaign launch is the first step.
This campaign launch may also be viewed via live streaming at TVUP and UP System YouTube channels, as well as on the TVUP and UP System Facebook pages. The playback will also be available for those who may have missed it or may want to review the proceedings.
Okay, Janelle, I can already feel the excitement from our audience. I think it's time we introduce our first speaker.
Yes, to formally open our program, it is a distinct honor to have with us no other than the chair of the Interagency Task Force for the Management of Emerging Infectious Diseases and the Secretary of the Department of Health, Dr. Francisco T. Duque III.
Malugod kong binabati ang ating mga kasangga sa UP Ahead sa pamumuno ni Dr. Elena Pernia ng UP Diliman para sa paglunsad ng kanilang kampanya laban sa vaccine hesitancy. Naway patuloy tayong magkaisa sa pagpapalaganap ng kaligtasan dala ng ating mga bakuna upang mahikayat ang ating kapwa na magpabakuna tungo sa sama-samang pagbangon ng bansa.
Thank you very much, Secretary Duque. Your stamp of approval is definitely very much appreciated. Our next speaker comes from the private sector and is a shining example of the power of collaboration when private institutions support government initiatives. Please welcome the Managing Director of McDonald's Philippines and the Chair of the Task Group on Strategic Communications with Task Force T3, Margot Torres.
Good morning. My name is Margot Torres. I'm the Managing Director of McDonald's, but I'm also the Communications Lead for Task Force T3. Like all of you, we are all yearning to go back to what we miss: being with friends, being with family, going to work, and going out without any apprehensions. We all know vaccines provide the added protection we need. And not only that, it provides hope that we will go back to the things we love doing. Task Force D3 is a consortium of private companies that has worked closely with Secretary Charlie Galvez, Secretary Vince Dizon, and the National Task Force since the start of the pandemic until now for the national mass vaccination rollout. As a member of the private sector, our greatest contribution would be to achieve herd immunity within our own communities, whether it is our family, whether it is our company, or our village. Another important contribution we all make is to make our family and friends understand the benefits of being vaccinated. Like all of you, we want to achieve herd immunity and enjoy a better Christmas and a better New Year. Thank you to everyone for all the hard work that you do. We all need to work together, and with Ingat Angat Bakuna Lahat, which is the campaign we have developed, we welcome all forms of communication that will help increase vaccine willingness and lower that hesitancy so we can all enjoy a better Christmas and a wonderful New Year. I hope you have a great webinar today. Good morning.
Thank you very much, Margot, for highlighting the importance of strategic communication packages to address the vaccine hesitancy among Filipinos. We are one with you in hoping and yearning that in the future, when the economy is fully open, because we have achieved population protection against COVID-19. And now, it is my pleasure to introduce to you the project leader of the Communicating COVID-19 in Post-Quarantine Philippines, of which this major launch is a result of their outputs. She is a professor at the Communication Research Department and former dean of the UP College of Mass Communication in UP Diliman. She is the president of the Philippines Communication Society and chair of the UP College of Mass Communication Foundation. Currently, she serves as the UP System Vice President for Public Affairs. Please welcome Dr. Elena E. Pernia.
Dr. Francisco Duque, Secretary of the Department of Health. Dr. Jaime Montoya, Executive Director of the Philippine Council for Health Research and Development. Ms. Margot Torres, Managing Director of McDonald's Philippines and the Chair of the Task Force on Strategic Communications with Task Force T3. Dr. Beverly Ho, Concurrent Director of the Health Promotion Bureau and Disease Prevention and Control Bureau of the Department of Health. Officials and staff of the Department of Health and the Philippine Council for Health Research and Development, and my colleagues in the project. A very good morning to all. Let me begin by providing an overview of the reason that we are here at this media launch. Heeding the need to improve COVID-19 communication in the country, we, a group of social science researchers, media and communication specialists from the University of the Philippines, put together a project to develop a research-based COVID-19 communication plan. Optimistic that the community quarantine measures would be temporary, we titled our project Communicating COVID-19 in a Post-Quarantine Philippines. The project, conceived during the early months of the COVID-19 public health crisis, sought to contextualize the pandemic infodemic situation in the Philippines. Specifically, the research component of the project investigated the public's COVID-19 literacy, their cognitions about the virus and its transmission, expressions of its impact on their daily life activities, sentiments or expressions of concern and optimism, attitudes about and trust in COVID-19 responses, and trusted information sources. Our main goal was to develop a research-based COVID-19 communication plan, as we believe that communication is an effective tool to build COVID-19 health literacy, instill healthy behaviors and practices, and thereby aid in the nation's transition to a new reality. Our research show that, among other things, one, there is a plethora of COVID-19 related information as covered by the media and reflected by social media trends. But despite all the science and evidence-based information available, COVID-19 literacy is low across all sexes, age groups, and regions. Throughout the year of the pandemic-induced quarantine, the primary emotions conveyed by Filipinos online had been fear, anxiety, and panic, but with considerable surges in sentiments of empathy, as indicated by organizing and responding to calls for donations. Second, current COVID-19 vaccination campaigns include catchy phrases, trendy styles, and a lot of statistics. Although the campaigns are getting some traction in terms of COVID-19 vaccine awareness, it requires one more ingredient to nudge more Filipinos to reduce their vaccine hesitancy and make that desired action of vaccination. There is a need to convert the COVID-19 vaccination campaign messages into narratives. As a result, our COVID-19 vaccination campaign revolves around the key message, Dahil Mahal ko kayo, Magpapabakuna ako. The campaign has been described as one that is feel-good, emotional, but science-based. Filipino values that reflect love, care, and responsibility for our family, and which extends to the virtue of bayanihan, form the framework of our message development. It is these core values that drive the desired responses. That is, for the priority groups to get vaccinated against COVID-19, to encourage others to get vaccinated too, and to continue healthy behaviors after vaccination. To conquer the fear and anxiety brought by the uncertainties and myths about COVID-19, its symptoms, transmission, effects, and prevention, messages that convey hope are needed. As the name of the campaign indicates, and as you will see later, our fundamental message is love. The 5 public service ads that we are launching today are narratives about loving and caring for family and friends at home, at work, and as we move from home to work and back. And because Filipinos have a playful and humorous side, 2 of our PSAs take an amusing and even comical tone to encourage people to get vaccinated. Apart from these video and audio PSAs, our team developed IEC materials that similarly carry the key message and tagline, Dahil Mahal ko kayo, Magpapabakuna ako. As our campaign recommends an omni-channel approach to enhance audience reach and to assuage misinformation, these IEC collaterals include explainer videos, posters and infographics, social media cards, and stickers that are appropriate for and formatted for various conventional and social media platforms. The PSAs and the prototype IEC materials that we are launching today were all subjected to pre-testing with public health experts and target audiences to ensure their scientific correctness, cultural appropriateness, and message aesthetics. It is our earnest desire that these media products of our research contribute to instilling healthy behaviors and practices, and indeed aid in the nation's transition to a new reality. Thank you very much.
Thank you very much, VP Nenny, for giving us a brief overview of the research project and a backgrounder on the communication plan component, which includes not just the production of audiovisual collaterals, but also information, education, and communication materials to change and reinforce behavior. I know you're already at the edge of your seats to experience our video materials, which were developed as a feel-good campaign that is emotional but science-based, using Filipino values as an anchor to reflect family love, family protection, and caring for others.
The primary target audience for the videos are the senior citizens who are in the priority A2 group. They are at higher risk of hospitalization or death due to COVID-19 than the rest of the population. The psychographics of this sector is that most do not have medical background and are heavily influenced by their grown children, neighbors, siblings, relatives from other countries, and what they read on social media. The senior citizens commonly live with their extended families, which are comprised of their children and grandchildren.
All right, so the first video is set at home, where a milestone birthday celebration amidst the pandemic will be celebrated. Let us take a look at their 75th birthday virtual celebration.
Birthday, Mahal!
Thank you, Mahal.
Happy birthday,
Happy
Mommy!
birthday,
Hi,
Mommy!
Dad! Hi, Mom!
Thank
Birthday!
you, mga anak. Thank you.
Love you, Mommy!
Miss na namin kayo!
I miss you, both of you. I miss you.
Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss na namin, Mommy. Happy birthday, Mommy.
Miss and love you, Mommy.
What did you wish for, Lola?
My wish, magpapabakuna na ako.
Ako din!
Dahil mahal ko kayo, magpapabakuna ako.
Our second video is set in a transportation scenario which has been identified as another higher-risk situation for COVID-19 transmission. Here, the critical role of the frontliner to encourage people to get vaccinated has been highlighted. From our research, most Filipinos verify their COVID-19 information from frontliner friends or relatives. Let us take a front seat at the jeepney.
Bayad po.
Salamat po.
Mama, bayad po.
Naku, anak. Tabi mo na yan. Para masuklian ko ang mga sakripisyo niya sa taong bayan.
Mapagbigay po kayo. Nakikita kong mahal na mahal ninyo ang inyong pamilya.
Tama ka. Kaya nag-aalala ako. Paano ba matapos tong pandemyang to?
Para matapos, umpisahan na ninyo. Magpabakuna na kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Our next video continues with the inclusion of the essential workers, this time by a grocery bagger who lives with his lolo. Many minimum wage daily workers have lost their jobs due to the pandemic, and the stress of seeing your meager savings dwindle adds to the increased anxiety. Let us listen in during their morning conversation over coffee.
O Apo, mukhang malalim yung iniisip mo, ha? Wala ka mapasok ngayon?
Wala po. May disinfection kasi sa grocery.
Ganun ba? Di ba wala rin kayong pasok kahapon? Pati nung isang araw?
Sana makabalik na ako sa trabaho.
Siya. Di na muna kita istorbohin at mukhang malalim yung iniisip mo.
Lo,
No?
magpabakuna na kaya tayo?
Walang problema, Apo. Paunahan mo lang ako eh. Talaga.
Dahil mahal ko kayo, magpapabakuna ako.
The next video is a whimsical look at our senior citizen who have been cooped up at home for the last year and a half. Finally, they are going on a date.
Sigurado ka na ba sa reservations natin?
Oo naman.
Bakit bihis na bihis ka?
Oo, magiging escort mo ko eh.
Mukhang may date si Lolo't Lola.
Ilagay mo kaya ito?
Ang ganda naman.
Maganda yan. Special ang lakad natin. Ano, ready ka na?
Ready na. Mom, Dad, aalis si Lolo't Lola. Oo, anak, after lunch. Sana lakad niyo po. Para sa atin lahat ito. Magpapabakuna kami dahil mahal namin kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Our final video breaks the stereotype of the macho trope. Here you see male frontline essential workers rallying each other to get vaccinated to protect their families. Based on our FGDs, the males are hesitant to get a vaccine because they think they are strong and they will not be affected by COVID-19, or they are afraid of the needle. Let's rally our support for the Tropang Tigasin.
Mahalaga ang lakad na ito. Tigasin ka ba?
Siyempre!
Mahal ba si Commander?
Mahal na mahal.
Pare, mahal mo ba ako?
Oo naman, ano?
Mahal mo ba ang tropa?
Oo ba?
Tara na! Magpapakuna na tayo!
Dahil mahal ko kayo, magpapabakuna ako.
Aside from the video materials, we also have audio versions and GIFs of each of the video. The bottom line is that these messages should penetrate the fear of COVID-19 vaccination through creating hope by focusing on love. The root of fear is the unknown, the unpredictable, and the thing one cannot understand. Fear should not be the driving force when making decisions because it will lead to erratic or short-sighted decision-making on the one hand, and indecision on the other hand.
COVID-19 vaccines can also help protect your family and friends.
COVID-19 vaccines are safe and effective. They have passed the usual clinical trials and scientific reviews by experts. It is safe for most people 18 years and older, senior citizens, and those who have controlled pre-existing conditions including hypertension, diabetes, asthma, pulmonary, liver, and kidney disease.
Even people who have already recovered from COVID-19 should still get vaccinated. But you need to complete the 2 doses of COVID-19 vaccine to maximize reduction of risk related to COVID-19, unless your vaccine is just 1-shot dose only.
Encourage your family and friends to sign up and get the COVID-19 vaccine.
Upon completion of vaccine, continue to practice standard health protocols to prevent the spread of COVID-19. Leave house only if necessary. Wear face mask and face shield. Wash frequently with soap and water or alcohol. Avoid crowded places and keep a safe 1-meter distance from others. Ensure proper air circulation by opening windows and let breeze in. Isolate if feeling unwell or sick.
For more information, follow your local government unit's official advice on how to access the COVID-19 vaccines.
Dahil mahal ko kayo, magpapabakuna ako.
love has been identified as the opposite of fear because it epitomizes certainty, predictability, as well as the intrinsic drive and value to protect the family. That kind of love is the emotion that will lead to action.
We have covered a lot of ground in under an hour, and now it is time to formally conclude our program. To give the closing remarks, please welcome the Executive Director of the Philippine Council for Health Research and Development, Dr. Jaime C. Montoya.
DOH Secretary Francisco Duque, friends from the media, and everyone who joined us in this launch, good morning. I would like to congratulate the Task Group on Strategic Communications Chair, Ms. Margot Torres, UP Vice President for Public Affairs, Dr. Elena Pernia, our hosts, Dr. Jonalu Labor, and Professor Maria Angelica D. Abad, and everyone behind the Dahil Mahal ko kayo, Magpapabakuna ako, Laban sa COVID-19 campaign. We cannot thank you enough for the initiatives you and your team have taken to disseminate accurate information so that we can urge our people to get vaccinated. Now, with the threat of the Delta variant looming, there is a pressing need to continuously and consistently amplify correct messages to the public. These materials you produced and ultimately the Communicating COVID-19 in Post-Quarantine Philippines project, more in tune to a public that consumes information and other content on demand and on the go, would aid us in getting our message across to a wider audience. Hopefully, fears and doubts on the efficacy of the vaccine in helping us move towards a brighter, more optimistic, and more productive new normal will soon fade as more civilians chime in with the Department of Health's Res Bakuna campaign. DOH has constantly released information materials on the vaccines through traditional, non-traditional, and digital platforms. And with the hope of moving forward, this month's goal is to share vaccination success stories from our countries, from other countries, to the Filipino people. After being isolated from each other for more than a year, other countries are starting to ease restrictions on the population as more jobs are administered to their citizenry. Imagine schools opening and businesses reopening. Imagine everyone taking trips to other parts of the country without worries. Imagine enjoying activities we used to enjoy before being isolated from our loved ones. If they can make this possible in other countries, the Philippines can do it too. As the country steps towards the new normal, the DOST PCHRD is also there to augment our health department's efforts to combat COVID-19 by supporting our local health researchers in their efforts to find solutions to the various challenges we face during this COVID-19 pandemic. We understand that while more and more people are falling in line to be vaccinated, we urge the public to understand that the COVAX facility is distributing vaccines based on urgency. As Delta variant cases surge in our neighbor countries, India and Indonesia, the facility will have to prioritize them. This, however, will not deter us from continuing our vaccination and research efforts. We hope everyone who joined us for the launch of UP's campaign, especially the members of the media, will also help us send out our message. It takes each and every one of us to end this pandemic. Again, to the organizers and to the individuals involved in this campaign, mula po sa kaibuturan ng aking puso, maraming salamat po. Magandang araw po muli sa inyong lahat.
Thank you very much, Dr. Jaime Montoya, for your very inspiring message, and our gratitude to everyone for your gift of time.
Yes, thank you so much, and we look forward to your continued support for this campaign to increase the number of vaccination in our senior citizens and our vulnerable sectors of our society.
And please remember, dahil mahal ko kayo,
Magpapabakuna ako.
Dahil mahal ko kayo, magpapabakuna ako.